series of our webinar Wednesdays. Following the cluster 6 this morning, we're going to be discussing today, presenting to you cluster 1, health, which is one of the important areas given the situation with the current pandemic that we have. So since last year, health has taken a kind of center stage, if I may say this, due to the COVID-19 pandemic. And as you can understand, quite a lot of money and effort is being put into health-related topics by the European Union. I will be showing you later in my slides how the EU is going about taking on board even the challenges it's currently facing with the pandemic. Just some housekeeping rules. The session will start shortly. We will be recording this session for it to be posted online. The presentation and the recording will be shared following the event. So after the event, this will be posted on MCST's website and also on the social pages of the Framework Programs Unit. You can ask questions by using the chat box. So if you have any questions, please feel free to put your questions there. We would be happy to answer any questions you have at the end of the session. And also there will be an opportunity for a live question and answer at the end of the webinar. So at the end, we will dedicate some time if you have any questions. As I told you, this is the third series of the webinar Wednesday, so it's the third Wednesday. We've already had digital industry and space on the 14th, and in the afternoon we had culture, creativity, and inclusive societies. On the 21st, we had disability security for society and climate, energy, and mobility. And today we had food and bioeconomy and health and the cancer mission this afternoon. Looking into May, also next Wednesday, we have the widening participation and Euratom, funding for SMEs, and this will include the EIC, the European Innovation Council, the EN, and the TDP. On the 19th, we have the Marie Curie Skłodowska Actions, and on the 26th, we have the European Research Council. By way of an overview, I'm going to try and cover the whole health sector where funding is involved. So just to start off, I will give you an overview of Horizon Europe, of the Horizon Europe program and the different actions and clusters there are under this program. We'll go over briefly the eligibility criteria, the type of actions and the funding rates. I will dedicate just one slide to let you know about an ongoing call which is currently open about COVID-19. This is an emergency call which was issued earlier this month. We'll go over the health work program where I will be giving you some in-depth views on the calls to be expected in 2021 and 2022. We'll go into the destinations and the topics of the health work program. We'll also go over the mission on cancer, which is a novelty in Horizon Europe, and we'll also go over the health partnerships at the end of the meeting. My colleague Lily will be putting in the chat some links, which I think could be very useful for you to get more in-depth information, because obviously I cannot give so much information over a webinar, but she will be giving you some links where you can also access the health work program, the full text of it. So if you have any doubts about, or maybe if I go too fast into the calls, for example, you can go and look up the calls. We will also send you some links to the webinar Wednesdays, just for you to have the agenda of when they are happening. Also, a link to the emergency calls, where to find them and what they are about. Link to the EU4Health program, a link to the mission on cancer, and the link to partnerships. So just in a nutshell, for those of you who don't know what Horizon Europe is the largest research program in the world, and it's worth around 95.5 billion euros. It consists of mainly the Horizon Europe program, which includes the specific program for the European Defence Fund, and then the main body of Horizon Europe, where the chunk of the funding is, under 3 separate pillars. So you have pillar 1, where you have more bottom-up calls, and these come under the European Research Council, the Marie Curie Sklodowska actions, and research infrastructures. Then in pillar 2, you have the clusters, you have the thematic clusters, and here's where health falls, and also the Joint Research Center. And then pillar 3 is more targeted towards the industry, and here you have the European Innovation Council, European Innovation Ecosystems, and the European Institute of Innovation and Technology. And then as a separate program, yet complementary, you have the Euratom, where you have the fusion, the fission, and the Joint Research Center actions complementing the Horizon Europe. One strand of calls will be the widening participation, which we will be covering next week, and that is transversal throughout the whole program. But we will come to that more next week, where we will be presenting specifically the widening participation. So in a nutshell, the eligibility criteria remains the same as Horizon 2020. You have 3 legal entities from 3 member states or associated countries, with at least one of them established in the member states. You may bring on board any other partners from any other country, but for the health calls, and I will stress this, that it's only for health, a novelty is that you can bring on board US entities from the United States, and they are eligible also for funding under health only. So it's only for the health team that this can be done. Conversely, this gives Maltese participants also access into the NIH, the funding research program of the United States. If you decide to participate in the NIH, you will also receive funding. So it's like a reciprocal agreement between the United States and the European Union. But again, I will stress that it's only for the health calls. At proposal stage, once you have decided what type of role you want to take on in the project, it's important that you allocate the necessary resources for the duration of the project. Obviously, the resources differ, whether you're a coordinator or a work package leader or a task leader or just a beneficiary. Obviously, one has to adapt his proposal and resources accordingly. At MCST, we generally advise our applicants, especially the ones who are applying for the first time in this program, to apply as a partner, either as work package leader or as task leader if they're applying for the first time. Once you get more acquainted with the program, then we advise that you attempt to apply as a coordinator. But applying as a coordinator requires a good administrative setup to allow you to participate to lead the project. So basically, being a coordinator, you have to be the kind of forefront, at the forefront of your consortium with the commission, and you have to find the balance between the commission and the consortium. So there's the day-to-day running of the project. You have the day-to-day discussions with the commission, the deliverables, the reporting, etc. So do speak to us if and when you decide to participate as a coordinator. From 2022, a novelty is that one of the eligibility criteria is the gender equality plans, and this this is currently under discussion, but it will become a requirement from 2022. And also, obviously, always check the conditions of the call, the general annexes, just to make sure that you have the full updated details of the call you are applying for. In a nutshell, the actions and the funding rates are split into three. There are three types. So you have the research and innovation actions, and these run from TRL 1 to TRL 5. Then you have the innovation actions, which run from TRL 5 and up to TRL 8. And then you have the coordinated support actions. And here the EU funding rate is 100%, whereas for the innovation actions, it's between 70 to 100, and even for the research and innovation actions, it's 100%. Good. So having covered now the framework program in fairly briefly, we have a number of videos which you can access online, which give more in-depth explanations of the research of the Horizon Europe program. So if you have any questions, I would be very happy to answer about them. But if you want more details, we have specific videos posted online, which you can see. So as I told you in the very beginning, since COVID-19 started, quite a number of health took center stage where it comes to health funding. All of a sudden, quite a lot of funding programs have mushroomed up. The main funding program for research remains the health work program, which we are discussing today. So that is kind of the main platform from where all the other calls then come into play. One call which has developed since last year is the COVID-19 emergency calls, and I believe we're in the third or fourth emergency call already. One is currently open this month, so it opened in April and it closes on the 6th of May. In my next slide, I will be giving you the titles of the calls which are currently open for COVID-19. And since 1st January 2021, we have the EU for Health program, which is a program aimed to boost the EU preparedness for cross-border threats, strengthen the health systems to face epidemics, and make medicines and medical devices more available in the market. As you can see from this small introduction, you can already deduct that the EU for Health program is a kind of new platform which was created to respond to the COVID-19 emergency also. So really, there's a lot of effort going into health. Under the health cluster, we have two novelties. So there is the mission on cancer, which will be a mission run over 7 years to tackle cancer with the aim of reducing cancer patients by 2030. Then there are the health partnerships, which I will be listing at the end of my presentation. Malta will be participating also in a partnership, and I will be explaining further. And then there are smaller funding programs, such as the Innovative Medicines Initiative, for example, the DCTP, which is clinical trials in Africa, but this is now coming to an end and it will be taken on by a partnership. There's the EIT Kick for Health, there are the health prizes, there's a Fit for Health, so there's quite a lot to choose from. So I just thought of giving you an overview of what funding is available out there. So this is the COVID-19 emergency call, which is currently open. As I stated, the deadline is on the 6th of May. I would strongly suggest that you consult the funding and tenders portal to go into each and every call to see what requirements there are. We already have information that a number of consortium are already applying for different calls. The total budget for this call is 123 million. So it's quite considerable for 4 calls. and they're calling for EU-wide consortia. So it's not the typical call that you have a bunch of member states taking on sort of projects on their own, but more like wider projects that can carry out clinical trials across the whole of the European Union. So inevitably they would need to take on board Maltese and other partners on board. This call comes actually as a response to the variants that have been coming out of COVID-19 since December. So as a response, the European Union decided to focus this call specifically on tackling these variants to respond in a way with calls that can study more the variants and see exactly how we can mitigate the impact of what is happening at the moment. So the health work program, as I told you, is cluster 1 of pillar 2. It's the main vision of the health work program is good health and high quality accessible healthcare. A resilient EU prepared, like the institution have to be resilient and prepared for emerging threats, a high quality digital services for all, and also competitive and secure data economy. One of the pillars of the health work program for 2021 and 2022 is the digitization of health. This has been coming for a number of years now, and digitization has taken a bit of center stage, but as you can see with the other components of the vision, there is also the accessibility for all, for healthcare services, and also the emerging threats, which also obviously includes COVID-19. So it's a bit of a mixed basket of priorities, given the exceptional circumstances we are in. So we are very much in the final stages of negotiating the work program for 2021 and 2022. Lily has sent you already in the chat box the link where you can consult the work program. I would invite you to have a look at them, especially now whilst I'm going through the calls. If there are any calls that are of particular interest to you, do get in touch with me, and we can together get into more detail on the individual calls. But if you want to consult for yourselves at this stage already specific calls, you can follow this link, and you can have access to the full details of the calls and what is expected out of the partners applying for the individual calls. So the work program has 6 main destinations. Destination 1 is about staying healthy in a rapidly changing society. And here you'll find calls targeted towards healthier lifestyles, behaviors, healthier diets, healthier environments, improved evidence-based policies, more effective solutions for health promotions and disease prevention, for instance, and obesity, for example, mental health comes into play here. So there are, I mean, it's on this level that destination 1 is trying to tackle the challenges under this destination. Destination 2 is about living and working in a health promoting environment, and here the focus is on better understanding of environmental, occupational, social, and economic determinants of health. Destination 3 is about tackling diseases and reducing the disease burden. Again, here we are talking about understanding the diseases, having more technologies in place to detect them early, and also to mitigate once the disease is there. There's also the preparedness, the pandemic preparedness. COVID-19 has shown us that Europe was completely unprepared for a pandemic. So a lot of calls are geared towards this pandemic preparedness, whereby we are already prepared before the disease hits us. Destination 4 is about ensuring access to innovative, sustainable, and high-quality healthcare. High-quality healthcare is something which the European Commission has put a lot of emphasis on, because sometimes you have the main hospitals which are quite well equipped, quite advanced, and then you have maybe not for Malta, that's not really the case for Malta, but in other countries, for example, then you have hospitals in the regions, which are kind of outlying regions, which have very badly equipped or not as state of the art as the main hospitals. So here the target is to make sure that the healthcare is of high quality across the board, and not that some European citizens have different accesses to different standards of healthcare. Also, the accessibility of healthcare is also something else which is of importance in this work program. Destination 5 is about unlocking the full potential of new tools, technologies, and digital solutions for health societies. This is one of 2 destinations whereby a lot of effort is being put on the digitization of health. So here you'll find calls on health technologies, new tools, and digital solutions for the deployment of healthcare services and policies, for example. As I told you in the beginning, the digitization has for a number of years been one of the hallmarks for health. So it's I mean, the digitization is a priority for our healthcare systems. And then there is Destination 6, which is about maintaining the competition of the healthcare industry, and improve the access to and supply to critical health technologies. So here again, digitization does come in a little bit, but it's more about creating the technology, like something new, the new products. The health work program is around a bit less than 2 billion euros for 2021 and 2022. There is a bit more than 1 billion euros committed already for 2021 calls, and a bit less than 1 billion euros for 2022. And here you can see a table. I prepared a table to show you the distribution among the destinations. You will see that for Destination 2, most of the calls will be coming out in 2021. I've met with a number of stakeholders, and the people I've met, that initially I was telling you that, for example, this call is coming out in 2021, but then they have been shifted. And this was part of the play, but it's because the Destination 2 required a lot of calls to be front-loaded from before. So hence why you can see quite a big chunk of budget being committed already in 2021. So this is about, sorry, I have to go back. Okay, so this is about Destination 1. These are the calls, the dates that you can see in the brackets relate to the date when they are going to be issued. So if it's in 2021, it means that there is the call coming out in 2021, and in 2022 it means the call is coming out in 2022. With regard to the mental health and mental illness call, there is one in 2021 and another one in 2022, so it's coming out twice. Here you'll find calls like, for example, personalized prevention, artificial intelligence tool to predict and to predict the risk of chronic non-communicable diseases, obesity calls, for example, personalized blueprint for chronic inflammation in health to disease transition, that's coming out in 2022. So these are the calls to be expected under Destination 1. For the health work program, the main deadlines. So these are the deadlines only for Destination 1. So what I've shown you on the previous slide were the calls that are coming out in Destination 1. And these are the deadlines. I told you that some are coming out in 2021 and some come out in 2022. For the 2021 calls, the deadline is expected on the 21st September 2021. The launch is imminent, so we're expecting the launch of the calls mid-May, with a closure on 21st September 2021. And for the 2022 calls, there are some calls which are two-stage, and the two-stage calls will be closing on the 1st of February 2021, stage 1, and in September, stage 2. And then there are other calls which will be launched just before Christmas, which will close in 21st April 2022. So in reality, the dates you have to keep in mind are 21st September 2021 and 21st April 2022, because now you will see from the next slides, most of the deadlines are quite uniform across this work program. So this is about Destination 2. And here you'll find calls such as, for example, the health impacts of climate change, costs and benefits of action and inaction. That's coming out in 2021. Indoor air quality and health. So here you have some calls related to the environment, like how the environment impacts our health. And also there's also the preparation for the partnership for the assessment of risks from chemicals and methods for assessing health-related costs of environmental stressors. That's coming out in 2022. Again, the deadlines are quite uniform across this work program: 21st September for the 2021 calls and 21st April for the 2022 calls. As I told you, quite a chunk of calls are coming out under this destination in 2021. So you can see 330 million just for 2021. I must add that a bulk of this project is going towards the Partnership for Chemicals Risk Assessment. So probably this also explains a bit why it's so high, whereas 2022 is so low. Then there is Destination 3, and here there are quite a number of calls, and this is aimed towards tackling diseases. You have over here also calls about understanding the disease, caring for the disease, and also developing vaccines for the diseases. So I mean, you have the full spectrum relating to mitigation for disease prevention, and here again, obviously, COVID-19 comes into play, because this is where this destination is coming from. So this is about Destination 3. Again, the deadlines are quite uniform: 21st September for 2021, 21st April for 2022. Then there's Destination 4, and here is about enhancing the quality of care and patient safety, data-driven decision support tools for better healthcare delivery and policymaking with a focus on cancer, healthcare innovation procurement network. These are all coming out in 2021. Then you have the resilience of healthcare systems in the context of recovery, better financing models for health systems, and the European Partnership on transforming health and care systems. And here, I can already announce that MCST is looking into participating into this partnership. So at the end of my slides, I will be putting up the list of partnerships, and I will be talking about this at the end of my presentation. But it's good to know that it's coming out as a coordinated support action under Destination 4 of health, whereby preparations will start rolling for this partnership. Again, here the deadlines are quite uniform: 21st September for 2021, 21st April for 2022. With regard to Destination 5, this is where digitization starts for health, and here you have innovative tools for the use and reuse of health data. For instance, next generation advanced therapies to treat highly prevalent and high burden diseases with unmet medical needs. Smart medical devices, for example, these are all coming out in 2021, optimizing effectiveness in patients of existing prescription drugs for major diseases, except cancer. It's except cancer because this is a topic which will be taken up by the mission on cancer, not this year, but probably starting from next year. So this is why you'll find many of the health-related calls not including cancer, because we have a specific mission on cancer, which will probably tackle these topics later in the mission program. And then you have in 2022 the computational models for new patient stratification strategies, for instance. Again, quite standard deadlines: 21st September, 21st April, and this two-stage call will take place, will close on the 1st of February and again in September for stage 2. Destination 6, and here we have, as I explained before, this is the destination where the competition of the healthcare, of the EU healthcare system comes into place. And here you have funding for green pharmaceuticals, for example, the development, procurement, and responsible management of new antimicrobials, promoting a trusted mHealth label in Europe. These are the 2021 calls. Then for 2022, we expect the enhancing cybersecurity of connected medical devices, scaling up of multi-party computation, data anonymization techniques and synthetic data generation, new pricing and payment models for cost-effective and affordable health innovations, setting up of a European Smart Health Innovation Hub, and the setting up of a European Electronic Health Record Exchange format. This is a new ecosystem with regard to health records in the European Union, which is currently being developed, and this is expected to be launched in 2022. Again, the deadlines are quite standard: 21st September, 21st April 2022. So this is an example of, I just chose one topic of the whole work program, and I chose this one. I chose this one because since the beginning of discussions about the health topics, most Maltese stakeholders have been interested in this one. It's interesting because it has a bit of it touches a lot of areas, because you have advanced therapies for highly prevalent and high burden diseases with unmet medical needs, and it's generating quite a lot of interest. So I decided to show this one. Here the Commission estimates. So this is basically what, if you go into the health work program in the link I showed you before, and in the link which Lily has sent you, when you go on a call, you will find the calls in this manner. So you first have the horizon, the title. Next to it, you can see this kind of code, which here I can translate it for you. It's about horizon, so it falls under horizon. Health is the health work program. 2021 is the year when the call will be issued, whether it's 2021 or 2022. The tool, it's because it relates to the destination. So each destination has a kind of code, and the destination for this call is tool. And then it's the call number. What you see 0602 is the call number. So if you want to get in touch with us with regard to a specific call, if you quote this code, we would be able to locate your call, and it's I mean, this is how we normally locate the call, the specific calls. Here, the commission has a total indicative budget of around 60 million, and the EU contribution is of around 6 million per project, which means that around 10 projects will be funded. It's quite a large call. So it's a large call because you have 10 consortia apply getting funding for the same kind of call. Obviously, the trick under this call would definitely be the type of high burden disease that you choose. The more rare the disease is, probably the more chance you have to be successful, because if one would have to focus on one specific disease, for example, and you have 10 applications coming for the same disease, you have 10 people. So apart from being better than the rest, then you have to be the better of the 10 for you to get that project, because they would not fund the same project for the same disease. So this is why the budget is quite big. And the type of action is a research innovation action for this call. Then if you scroll down, the work program gives you the information about the expected outcome, who the target group is, whether it's the competent authorities, the clinicians, researchers, etc. The scope, so it gives you also the scope of the call, what the commission wants out of it, what type of research it's looking into, and what profile that the project should demonstrate. Kind of once you have, if you have a 6 million euro project, you're probably talking about a very large consortium of around 15 partners, each of them doing a different task within the project. So this gives you guidance what the commission expects out of this project. So how do you identify topics? Lily sent you the link to the funding and tenders portal. Once you're in the funding and tenders portal, you just input a keyword. We just tackled, for example, high burden diseases, for example. When you want to see what other calls there have been with regard to high burden diseases, you just go to the funding and tenders portal and type in the keyword, and then the calls will come up for you, and you are able to access all the information about the objective of the call, the scope of the call, the budget. There is also a partner search facility once you open the call. So there's quite a lot of information to tap into when going into the funding and tenders portal. One thing I would like to highlight is that I don't believe the calls that are coming up now in 2021 are yet online. They still have to go online. But you can see the past calls just for you to get an idea of what type of calls have been funded before, and maybe even there is also a facility separate from this where you can access also previously funded projects on the same topic. As I mentioned, there's also, like, this is a novelty, the mission on cancer. So with Horizon Europe, one of the novelties is the launch of missions for health. We have the mission on cancer, and the slogan for this mission chosen was Conquering Cancer Mission Possible. And the target is that by 2030, more than 3 million lives are saved. For 2021, the only call that will be launched will be a coordination support action, which is the preparation of UN CAN. So it's about cancer, cancer portal whereby people can input information about different cancers, and kind of a portal to generate all the knowledge that there currently is about different cancers. So this portal will be the flagship of this mission. It will be the center point, hopefully in the future, whereby for any cancer, you will have a one-stop shop to go to it and to find all the relevant information about that specific cancer. And that is thought to help the clinicians and the doctors to really find some common ground, at least for Europeans, how to tackle cancer and how to prevent it, how to treat it, and possibly even the aftercare of cancer patients, etc. As I told you, also a novelty under, not really a novelty, but let's say it's a novelty because now all the cascade funding that we were used to under ERANET, under Horizon 2020, Article 185s, etc., now come under one umbrella, which is called partnerships. And as you can see, I told you also in the beginning that there was, for example, the EDCTP is now going to be translated into the European Partnership for EU-Africa Global Health. The IMI initiative, which was the Innovative Medicines Initiative, is being changed into I believe, the personalized medicine, yes. Malta is going to be, is currently in the process of, MCST is currently in the process of considering the participation under the European Partnership on Health and Care Systems Transformation. But more details on this will be given to you in the near future once we have the full details about how this partnership will operate. One new partnership which is currently under discussion is also the European Partnership on Pandemic Preparedness, but it's still very early stages. We expect in 2022 a CSA to be launched on this pandemic preparedness partnership, and then probably the launch of the partnership in 2024. So this is the full list of health partnerships. MCST is the national contact point for the whole Horizon Europe program. We are 6 NCPs with our coordinator, Antea Fabri. I take care of health, research infrastructures and widening in the European research area. We have several pages where we transmit information, especially when the calls are launched. I encourage you to become members as stakeholders and to register through MCST's website, but also to register on our Facebook page. We have a LinkedIn page, we have a Twitter page, and we also have a YouTube channel where this video and other videos and other webinars that we organize are posted there. So this is it from my side. I tried to cover as much as I could in the shortest possible of time. I'm sorry if I took too much of the question and answer, but I am available for any questions that any one of you may have. I'm not sure if we have anything in the chat box. No, not yet. I see that there are no questions. I take it that I was 100% clear on this. But anyways, you have my email address. Please feel free to send me a message or to email me if you have any questions or queries, and I would be very happy to answer to your questions. Thank you for your attention, and I wish you luck, and hopefully we can get as many projects as possible from Malta. Thank you.